is your question?
Okay, I'm ready.
All right. So if you've read and understood, considering Gate Communication Skills Station, please begin.
Okay, hello, I'm Dr. Alam, Senior House Officer working for Mr. Mann in the Royal Hospital, calling to speak to the Mr. John, which is a vascular consultant in the Royal Hospital as well. Could I confirm that I'm speaking to Mr. John?
Yes, please summarize your case.
Yes, I have a lady which is 54 years old, admitted today complaining of abdominal pain and diagnosed with a mild diverticulitis. Her symptoms begin improved with the assistance of intravenous fluid and antibiotics. Then she developed sudden onset of acute and severe lower limb pain, and we are doing the investigation and confirms that she has acute limb ischemia. Vitally, she is stable with the blood pressure of 120 over 80 and the pulse rate with the 96 and respiratory rate with the 80 cycle per minute, and urine output is the 50 ml per hour. On examination, his abdomen is lax, not tender, and she has no any positive in the examination. Then we order investigation. We do ECG, which show there is atrial fibrillation and broad periventricular complex, and we do ABG, which is found metabolic acidosis and hypokalemia. And we also do arterial duplex ultrasound, which confirms the acute limb ischemia.
Is it urgent? Can you send it tomorrow morning instead?
What? I'm not hearing you well.
Is it urgent at this time? Would it be possible for you to send the patient early in the morning tomorrow?
No, it's urgent because the patient had acute limb ischemia, which is critical, and she need urgent intervention for fear that she going to lose her limb. So we need to refer her now.
Do you need cardiologists to review for preventricular cardiac beats before transfer?
No, we do the abdominal examination, which is found that the abdomen is lax and not tender, and I can do the serial abdominal examinations, or I can do a CT abdomen to exclude other differentials.
What do you think of her presumed diagnosis of diverticulitis?
What?
What do you think of her diagnosis of diverticulitis?
I'm not think it is diverticulitis because the patient had atrial fibrillation, which is confirmed by the ECG, and she also had acute limb ischemia, which is caused by emboli, confirmed by arterial duplex. So I think the abdominal pain, which is presented with, caused by the mesenteric ischemia, not diverticulitis.
Do you want to scan the abdomen right now?
What?
Would you be wanting to scan the abdomen first?
For now, no. Maybe later. Now I need to refer her for you for definitive management and intervention, and we can scan it later on after the refer.
Do you think that it can be mesenteric ischemia?
Yes, it could be mesenteric ischemia because of atrial fibrillation, and she also had the embolic acute limb ischemia. So it could be mesenteric ischemia.
And what if the renal functions are not normal?
The renal functions, we just have the electrolytes, which found that there is a hypokalemia, but we did not do the urea and the creatinine. I could check them and update you.
If you find a deranged renal function, how could you say?
What? Your voice is not clear. I'm sorry.
If there is a decline in the renal function and deranged electrolyte, how will you manage?
How to manage it? Okay. First, I will manage her by care of critical ill surgical patients. I will treat the underlying cause. Then I will give her control the risk of the rhythm and the rate by giving her beta blockers and the amidarons. Then I will give her anticoagulant medications. I will give her about 80 international units of IV unfractionated heparin, followed by low molecular weight heparin. Then I will follow her and I'm doing the renal function test.
How will you manage atrial fibrillation?
What?
How will you manage atrial fibrillation?
The real what?
Atrial fibrillation, how would you manage it?
Atrial fibrillation. Okay, I will then I will manage her according to the care of critical ill surgical patients, as I told, and I will control the rate and the rhythm by giving her beta blockers and the amidaron. Then I will give her anticoagulant to prevent formation of other clots or thrombi. Then
So,
I will follow her and monitoring her vital signs.
what kind of ambulance will you need?
I will use the emergency ambulance with the blue light flushings, with interfacilities transport, the critical type, prepared with the CPR set and the syringe pump of cardioversion drugs.
Which type of anticoagulant you will give?
I will give her unfractionated heparin intravenously, 80 international units, and followed by low molecular weight heparin, about 18 milligram subcutaneous.
How can the ischemic limb be managed?
It's according to the severity and the site of obstruction. Generally, I can manage her by embolectomy or thrombolysis or bypass, or if it is late, I can go for amputation if the limb is dead or become deadly.
What will you tell the family?
What?
What information will you give to the family?
Okay, I will told the family that the patient is developed sudden decrease in the circulation to the lower limb, so she needs early intervention. For that, we transfer her for the vascular consultant.
All right, you can send the patient.
Okay, thank you so much.
Thank you.